What is heart disease? Do you know heart disease kills more people every year than all types of cancer combined? Every 33 seconds, someone in the US dies from heart disease. But here's the truth most people don't know: it's preventable. Heart disease isn't just one condition. It refers to a group of disorders affecting the heart and blood vessels. The most common type is coronary artery disease, CAD, narrowing or blockage of the heart's arteries due to plaque buildup, atherosclerosis, leading to heart attacks, chest pain, angina, heart failure. Other types include arrhythmias, irregular heartbeats, heart valve disease, congenital heart defects present at birth, cardiomyopathy, disease of the heart muscle. Many people have no symptoms until it's too late, but some warning signs include chest pain or tightness, shortness of breath, fatigue or weakness, swelling in legs, ankles, or feet, irregular heartbeat, dizziness or fainting. For women, heart attack symptoms can be more subtle: nausea, jaw or neck pain, unusual fatigue. Why you must learn palm diagnosis. Put your hand on your chest. Do you truly understand the real condition of your body with full confidence? These tragedies often happen in just a matter of minutes. But what's even more frightening is, we always think that accidents are far away from us. Health problems often develop gradually. Heart issues are no exception. Some are present from birth, while others arise over time due to neglect. Certain palm signs may even indicate the need to carry fast-acting heart medication at all times. The purpose of palm diagnosis is early prevention before serious illness occurs. It reveals not only the potential future risks, but also the hidden causes from the past. By learning it, you gain the power to protect yourself. Mastering palm diagnosis, once you understand which lines point to which health issues, you can begin to steer your body in a better direction. Even before problems actually appear, you'll know how to take preventive action. This makes it one of the best tools for preventing illness before it happens. There are many paid courses of palm diagnosis on the market, but our course stands out as a true synthesis of the finest palm diagnosis traditions from China, India, and Japan. A refined conclusion based on 15 years of hands-on experience by Professor Guo. Over the past 7 years, this method has been rigorously tested both online and offline by distributors and validated by hundreds of thousands of participants, resulting in an exceptional accuracy rate approaching 100%. Today's video is to teach you how to take your health into your own hands. We won't just talk in vague theories. Instead, we'll teach you a practical, visible method to detect health risks. By observing changes in your palms, you can spot early warning signs of heart problems. Whether you're a hardworking professional, burning the midnight oil, a fitness enthusiast, or someone caring deeply about your family's health, this knowledge can help you hit the pause button before danger strikes. The 3 main lines. First, let's briefly go over the 3 main lines. The heart line primarily reflects a person's respiratory system and lungs. Since the lungs and large intestine are interconnected in traditional Chinese medicine, this line can also indicate intestinal issues. Additionally, it is closely related to a person's emotional state. The head line is related to a person's mental thinking, cardiovascular system, nervous system, and digestive functions. The lifeline is like the trunk of a tree. It is connected to a person's longevity and immune system. See the signs before the symptoms. Let's start by getting to know the Laogong acupoint. Laogong, PC8, belongs to the pericardium meridian of Hanjuan and is categorized as the yin spring point on this meridian. It is located at the center of the palm. To locate it, make a loose fist. The Laogong point is where the tip of the middle finger touches the palm. This point is often used in the treatment of cardiovascular issues and emotional or mental health conditions. Now everyone can try to locate your own Laogong acupoint. Next, let's find the first line related to the heart. It's called the Guanqiao line. This horizontal line is called the Guanqiao line. It usually appears around the Laogong point, or between the heart line and the head line on the palm. Sometimes it's not exactly at the Laogong point, it might be slightly off to the side. When these marks connect to form a line, we call it the Guanqiao line. The presence of this line indicates that the person already has some heart-related issues. If you have this line, don't worry, this is the mildest sign of heart-related issues. There are more advanced indicators that we'll talk about next. Usually, this type of damage is caused by medication, such as taking drugs during a fever, allergy medications, or from certain habits after exercise or sports, like drinking cold, cool, or iced water right after sweating heavily. Next, we move on to the advanced sign of heart issues, the cross line. The Guanqiao line can be found by locating the Lao Gong point, which lies between the heart line and the head line in your palm. Look at the circled area. Now, the cross line appears when an additional line intersects the Guanqiao line, forming a visible cross shape in that same area. Check both hands, regardless of gender. The signs can appear on either the left or right hand, and both are important. When an extra line intersects the Guanqiao line to form a cross, it often indicates arrhythmia, palpitations, or rapid heartbeat. Some people may not feel any obvious symptoms, and these irregularities can only be detected by wearing a 24-hour Holter monitor, as they often occur at night while sleeping. At this time, it actually indicates that the heart is already experiencing some insufficient blood supply, such as the presence of slight blockages. Next comes the phone line, which indicates a condition more severe than the previous one. When the cross line on the Laogong point evolves into the phone line, it indicates a very high likelihood of coronary heart disease. It is usually accompanied by symptoms such as chest tightness and shortness of breath. It represents a relatively obvious blockage in the heart. This kind of phone line carries a relatively higher risk compared to the previous ones. Teacher Xiaoqing often gives lectures across the country and has helped rescue 20 to 30 people who suddenly fainted or experienced acute angina while on the road. Among the people she has treated, she observed their hands and found that 97% had the phone lines, while 30% had the cross lines. So if you have the phone line, you must pay special attention and take it seriously. It definitely requires proper care and treatment. There's another type, which is a cross line as well, but it goes a step further than the Guanqiao line and the regular cross line, because in this case, the head line and the heart line are closer together. When the heart line and the head line are closer together, it indicates weaker heart and lung function, meaning lower cardiopulmonary capacity. As a result, the person tends to get short of breath easily when running or walking. So, if you only have the cross line, but your head line and heart line are close together, you should still take steps to improve your health. Here are some combinations where palm lines and physical features work together to reveal deeper health insights. For example, when the fatty mound, thenar eminence, is relatively prominent, the area inside the frame is called the fatty mound. It's the raised, fleshy part. This is a combination of the phone line along with a prominent fatty mound. If someone has the phone line along with a prominent fatty mound in this area, their risk of heart attack or angina is very high. This is because it indicates that the coronary arteries have already undergone hardening. The blood viscosity is high and blood flow is slow. Combined with insufficient blood supply to the heart, this makes it especially easy for high-risk cardiovascular problems to occur. There is also another type where the person's thumb is very short. If the thumb is relatively short and doesn't reach halfway up the first segment of the index finger, it indicates that the heart has a congenital weakness or has not been very healthy since childhood. But if the space used to be wider and later becomes narrower, this indicates an acquired issue. For example, if there is a combination of the Guanqiao line and the cross line, it means the problem developed later in life. This signifies heart issues, where there is already some blockage or congestion in the blood vessels inside the heart. If the space between the heart line and head line on a person's left hand is relatively wide, but their right hand becomes narrower, it suggests an acquired condition, that after birth, their body was affected by factors such as medication damage or other issues that impacted the heart. Some people may experience changes in the same hand. If the distance between the head line and the heart line was originally wide, but after 6 months or a year, the hand becomes narrower, it also indicates that their cardiovascular system, especially the heart and brain blood vessels, has developed blockages. You can look at this hand, its thumb is relatively short. At the same time, we can also see that it has a phone line. Here, there is a new point of knowledge. These three indicators all point to a risk for the heart. For example, we can see the heart line has a forked branch at the spot circled in blue. At the blue circled area, we can see that the heart line splits into two nearly equal forks at its tail end. This situation also requires attention to the heart. This is a case where teacher Xiao Qing once helped a person who had fainted on a train. The person was only 26 years old. Everyone can see that she has two risk indicators. The lines on our hands represent risk levels. The more risk indicators you have, the higher your risk is. Look at this hand. Besides the forked heart line and the phone line, the fatty mound is also relatively prominent. Starting from the palm diagnosis images with the quick-acting heart pills carried on hand, these hands basically represent cases prone to sudden cardiac death, heart attacks, and angina. Here is another example of a hand showing signs of someone at imminent risk of a heart attack. Here, at the thumb's knuckle area, there is an added knee line. Please take note of this. The other features include a thumb pattern combined with a forked heart line. Why do we say this person is at risk of an imminent heart attack? We can see that their cardiac enzyme levels and electrocardiogram, ECG, are both abnormal. Many people might not fully understand the difference between a heart attack and angina, so I'll share a brief reference for everyone. What's the difference between angina and a heart attack? Angina pectoris is usually caused by a fixed narrowing or occlusion in the coronary arteries. This leads to reduced blood flow and a temporary lack of oxygen to the heart. In contrast, a myocardial infarction, a heart attack, is caused by the rupture of a coronary plaque, which triggers blood clot formation and completely blocks the artery. Types of angina include stable angina, usually triggered by physical activity. Unstable angina, more unpredictable and can occur at rest. Variant angina, caused by sudden coronary artery spasms. Types of myocardial infarction, MI, include non-ST segment elevation MI, NSTA, partial blockage, less obvious ECG changes. ST segment elevation MI, complete blockage, significant ECG changes. Let's talk about what's really happening in your heart when angina or a heart attack occurs. Angina pectoris, what causes it? It all starts with narrowing or blockage in the coronary arteries. This restricts blood flow to the heart muscle, leading to reduced oxygen supply. The result, chest pain or pressure, a classic symptom of angina. But when it comes to a heart attack, also known as myocardial infarction, the mechanism is more sudden and severe. It begins with the rupture of an unstable plaque inside a coronary artery. This rupture causes bleeding and clot thrombus formation, which quickly blocks blood flow completely. No blood means no oxygen, and without oxygen, part of the heart muscle begins to die. This is heart muscle necrosis. What are the key triggers and differences between angina and a heart attack? Angina is often triggered by physical exertion, emotional stress, cold exposure, overeating. But myocardial infarction or heart attack usually occurs without any obvious trigger. Chest pain duration also differs. Angina pain is typically short, just a few minutes, usually under 15 minutes. It often goes away with rest or medication. Heart attack pain lasts much longer, from several hours to even 1 to 2 days. It does not improve with rest. Next, let's discuss the location, nature, and accompanying symptoms of chest pain in angina and heart attacks. Pain location. In angina, chest pain is usually felt in the middle to lower sternum, or behind the breastbone. In myocardial infarction or heart attack, the pain can appear in the same area as angina, but may also occur in the upper abdomen. Pain nature. Angina causes a squeezing or choking sensation in the chest. Heart attack pain is typically more intense than angina pain. Accompanying symptoms. Angina usually does not involve gastrointestinal symptoms, low blood pressure, shock, or heart failure. A heart attack, however, can be accompanied by nausea, vomiting, and upper abdominal pain. In severe cases, low blood pressure, shock, and heart failure may occur. Now let's look at how angina and heart attacks differ in treatment response, ECG findings, and lab results. Response to medication. In angina, chest pain can often be relieved by taking nitroglycerin under the tongue. In myocardial infarction or heart attack, nitroglycerin is usually less effective or ineffective. Electrocardiogram, ECG findings. In angina, the ECG is often normal when not having an episode. During an attack, there may be temporary changes, such as ST segment depression or T-wave inversion. In a heart attack, the ECG shows persistent, characteristic, and dynamic changes, including ST segment elevation and deep, wide Q waves. Laboratory tests. In angina, blood tests such as complete blood count and cardiac enzyme markers generally show no abnormalities. In myocardial infarction, white blood cell count increases, and cardiac enzymes, markers of heart muscle damage, rise significantly. Now let's talk about how angina and heart attacks are treated. Treatment goals. The main goal in angina treatment is to relieve symptoms and slow the progression of coronary artery disease. For a heart attack, the top priority is to preserve as many heart muscle cells as possible and to prevent complications. Emergency response. In angina, the person should stop activity and rest immediately. If symptoms persist, nitrate medications, such as nitroglycerin, may be used. In myocardial infarction, immediate hospitalization is required. Treatment includes continuous oxygen therapy, ECG monitoring, and close observation. Advanced interventions. In severe cases of angina, vascular reconstruction may be performed to restore blood flow. In heart attacks, time is critical. Ideally, thrombolytic clot-busting therapy should start within 30 minutes of hospital arrival, or angioplasty intervention should begin within 90 minutes. Patients with stable angina can often live for many years with proper management and lifestyle adjustments. In contrast, the outcome for myocardial infarction, heart attack, depends on several critical factors: the size and location of the infarction, the development of collateral circulation, and whether treatment is administered promptly. Early intervention makes a significant difference in survival and recovery. Now let's return to the hand diagnosis. Actually, there are two more indicators: horizontal lines on the bridge of the nose and wrinkles on the ear. So there are 7 risk indicators representing heart issues, 5 from palm diagnosis and 1 each from the ear and the nose. Let's take a look at some real cases to see whether the points we've discussed are accurate. Everyone can take a look at this earlier hand, which also shows 3 key indicators. 1. A relatively short thumb. 2. A forked heart line. 3. A phone line. A medical report is also attached. If you know how to read hands, for example during a blind date, you can do what this person did: take a look at your date's hand to see if they're in good health. Once, a friend of teacher Xiaoqing went on a blind date and took photos of the date's hands. After analyzing them through palm diagnosis, teacher Xiaoqing noticed concerning heart signs and advised caution. The date responded by saying he had never experienced any heart-related symptoms. After all, he's only 29 years old and a soldier. Like many young people, he didn't think cardiovascular issues had anything to do with him. 10 days later, Xiaoqing's friend shared an update. The blind date began experiencing chest tightness, shortness of breath, and fatigue. A cardiac ultrasound revealed mitral and tricuspid valve regurgitation. He had felt no symptoms before. But 10 days earlier, teacher Xiaoqing had already identified the heart issue through palm diagnosis. So, is sudden cardiac death really without warning? Not necessarily. The key is whether someone understands the body's signals. Problems in the internal organs will manifest in the hands and face. This is the essence of inspection in traditional Chinese medicine. In some cases, even medical checkups and reports fail to detect any problems. In August last year, teacher Xiaoqing went to Beijing to examine someone's hand. Upon seeing the hand, she said that the person's heart wasn't in good condition, that their blood was thick, and they were prone to high blood lipids. The person then showed teacher Xiaoqing his health report on their phone, which showed normal lipid levels and no apparent issues. But 2 months later, in October, he developed heart problems. His daughter later put together an image summarizing what had happened. Everyone can take a look at the review written by his daughter. It shows that, in many cases, regular medical checkups may not detect any issues. But through palm diagnosis, the problems can often be clearly seen. Male, 73 years old. On October 10th at noon, he began experiencing chest tightness and shortness of breath, which slightly improved with rest. On October 11th at 12 p.m., he went to the emergency department at Anjin Hospital. An ECG was performed but did not meet the criteria for emergency surgery. However, the patient felt severe chest discomfort and was admitted to the emergency department. At 5:10 p.m. that same day, surgery was performed. Angiography revealed that stent placement was not possible. Surgical overview. The circumflex artery was found to be nearly completely blocked, and the other two arteries were also 80 to 90% blocked. During the procedure, the surgical team addressed the most severely blocked artery first. After inserting a stent, they discovered that the narrowest part of the vessel had a diameter of only 1.8 millimeters, while the smallest available stent was 2.25 millimeters. Although the guide wire could pass through, the stent could not be placed, so vessel dilation was performed. Due to concerns that keeping the equipment inside the vessels for too long could pose a risk to the patient's safety, the team did not place stents in the other two arteries and concluded the surgery. The attending surgeon planned a stent procedure on the morning of October 14th to place stents in the other two arteries. After surgery on the 11th, the patient was admitted to the CCU for monitoring overnight. Our hands can give early warnings about future health problems as well as reveal issues from the past. There's also this pair of hands. When I first saw them, they were very red, and the person said they had no health issues. But 2 years later, they suffered a heart attack. So sometimes the warning signs appear well in advance. Red hands are not a good sign. They indicate liver problems. In facial diagnosis, we look at the root of the nose, also called the Schangen, which corresponds to the heart area. If this area becomes darker in color or develops wrinkles, it's important to be especially alert for cardiovascular and cerebrovascular diseases. The groove on the ear, known as the coronary sulcus, generally indicates 30 to 50% blockage in the heart. If you have the lines I mentioned on your hands, along with these two features, you must take it seriously. Of course, our palm lines can change over time. Let me show you the ear changes of the person I mentioned earlier, who is at imminent risk of a heart attack. These lines will continue to change over time, so there's no need to worry too much. By following our guidance, we will teach you how to prevent issues, improve your overall health, and eliminate these risks.